Breast cancer is a very common type of cancer in women, with about 1 in 3 new cancers being breast cancer. However, the experiences and outcomes for women with breast cancer can vary greatly depending on their race and ethnicity. White women are more likely to get breast cancer than any other racial or ethnic group in the U.S. Black women are most likely to die from breast cancer, followed by white women, Native American/Alaska Native women, Hispanic women, and Asian/Pacific Island women. The reasons for these differences are complex and include systemic racism, which can lead to higher risk for low socioeconomic status and restricted access to care for people of color. While individual women may not be able to control these factors, it is important for all women, regardless of their race or background, to take charge of their care and seek the best possible treatment as soon as possible. In a study of over 450,000 women with breast cancer, it was found that non-Hispanic white women were more likely to be diagnosed at stage I compared to women of color. Routine mammograms, which are images of the tissue inside the breasts, can increase the chances of detecting cancer early. Some studies show that routine mammograms can reduce the risk of death from breast cancer by almost half within 20 years of diagnosis. The United States Preventive Services Task Force recommends that women aged 50 to 74 get a mammogram every other year, while the American Cancer Society suggests women should start getting mammograms every year from the age of 45 and then switch to every 2 years at age 55. Women aged 40 to 44 and 55 and older have the option to get mammograms every year if they choose to. If you've received a diagnosis of metastatic breast cancer, it's crucial to start treatment as soon as possible. Studies have shown that there can be longer delays in diagnosis and treatment for African American and Hispanic women compared to non-Hispanic white women, due to differences in access to care. To avoid these delays, it's important to advocate for yourself. Be proactive in following up on test results, scheduling appointments, and asking about the next steps for your care. If you notice any delays, don't hesitate to reach out to your healthcare provider. When it comes to treating metastatic breast cancer, the type of treatment you receive will depend on the stage of your cancer. This means whether the cancer is limited to your breast or if it has spread to other parts of your body. Metastatic breast cancer, which has spread to areas such as the lungs, liver, or bones, can be tough to hear. However, there are more treatment options available now than ever before. In fact, some women may live for years with the help of certain breast cancer drugs. For women with metastatic breast cancer, the usual treatment is systemic. This means that the medication works to fight the cancer throughout your entire body, rather than targeting a specific area with surgery or radiation. In some cases, doctors may also use radiation and surgery in addition to systemic treatment. There are different types of systemic treatments for breast cancer, and you may receive one or more of them. Hormone therapy. This is used for hormone receptor-positive breast cancers, which are fueled by the hormones estrogen and progesterone. The drugs either block these receptors or reduce estrogen production in the body. Targeted therapy. This treatment is directed at specific proteins on cancer cells that help them grow and spread. The most common target for these drugs is HER2. Immunotherapy. This helps your body's immune system recognize and attack cancer cells. It may be used in combination with chemotherapy for triple-negative breast cancer. Chemotherapy. This treatment uses drugs to reach and kill cancer cells throughout your entire body. These drugs can be taken orally or administered through a vein in your arm. When it comes to treating metastatic breast cancer, there is no one-size-fits-all approach. The best treatment for you will depend on the specific characteristics of your cancer cells. Factors such as hormone receptors, HER2 proteins, and proteins that may impact your immune system all play a role in determining the most effective treatment for you. Your doctor will need to conduct tests to understand the makeup of your cancer cells. If you're unsure whether you've had or need these tests, don't hesitate to ask. It's a good idea to come to your appointments with a list of prepared questions. Here are some questions you may want to ask your doctor. What type of breast cancer do I have? This may include information about your cancer stage, hormone receptor status, and HER2 status. Do I need more tests before we can decide on treatment? What are all the treatment options available to me? What are the pros and cons of each treatment? Which treatment do you recommend for me and why? Should I consider participating in a clinical trial? Should I seek a second opinion? Will that delay my care? Are there any programs available to help with the cost of care and insurance coverage? If the current treatment for metastatic breast cancer isn't effective for you, your doctor may suggest trying a different option. You might also qualify for a clinical trial, where you can access medications that are not available through regular channels. It's important to note that some studies have shown that doctors may be less likely to offer clinical trials to non-white patients due to biases. However, research has also demonstrated that people from racial and ethnic minority groups are just as willing to participate in clinical trials as white individuals. If you're interested in exploring clinical trials, talk to your doctor about potential options and how to get involved. Keep in mind that not all doctors and hospitals have access to clinical trials, so you may need to do some research on your own. You can start by visiting clinicatrials.gov and searching for trials related to your type of breast cancer in your area. When cancer treatments are no longer effective and you choose to stop receiving care, you can still receive treatment to help you feel more comfortable. This is called palliative care. It focuses on treating the symptoms and side effects of cancer, rather than fighting the cancer itself. The goal is to improve your quality of life and make you feel more comfortable at any stage of your cancer care. You have the right to receive palliative care at any point during your cancer treatment. It can be given alongside cancer-fighting treatments, and you can also continue to receive it if you decide to stop other treatments. If you decide to stop cancer treatment and are not already receiving palliative care, talk to your care team about getting it. The goal is to improve your quality of life and reduce your stress while living with cancer. Advocating for your own health care is crucial, especially when dealing with metastatic breast cancer. Here are some tips to help you advocate for yourself. Bring someone with you to appointments to help remember information and ask important questions. Communicate any personal challenges or beliefs that may affect your treatment plan. Make your care goals clear to your doctor. Know your rights, including the ability to ask questions, express doubts, seek second opinions, and change healthcare providers. It's important to remember that experiences with breast cancer treatment can vary based on race and ethnicity, but advocating for yourself can help ensure you receive the best care possible.